My name's Dr. Manrina Rhode, and today I want to talk to you about marketing as a dentist. We've had quite the marketing week at DRMR this week. We had Bill Dorfman come in to see us from LA, and we made a video, an impromptu video, right here in our patient lounge about how to become the most famous dentist in the world. According to ChatGPT, his clinic is based in LA, and he is the most famous dentist or cosmetic dentist in the world. And so I like to consider myself a famous dentist, and interesting to talk to him about how you become the most famous dentist. And so that was an interesting chat that I'll encourage you guys to listen to his advice. It's on my Instagram page, Dr. Manrina Rhode. I also had we have twice monthly open mic sessions with my mentorship, with my mentees in my mentorship program, and the open mic that we did this week was about dental marketing and about all the different avenues that are available to us as dentists. And you could talk for an hour on each one, so little snippets about each one, and my mentees hear about all of them from me all the time, and how they can be optimized within clinic so that you're seeing your ideal client and doing more of the treatments that you want to do. So let's go through them. Let's do an outline of dental marketing. First of all, with regards to how much you should be spending on marketing, I think you should be spending on marketing yourself to encourage these type of patients, the right type of patient to come in and to be able to find you. And if you want to be the most famous dentist in the world, then definitely, but definitely if you even just want to be attracting the kind of patients you want to see, you need to have a marketing budget. And so what should that be? It should be a percentage of turnover. So as an associate or as an established clinic where you've already got word of mouth people coming in, or an established patient client base, that could be anything from 1 to 3%, but I think you definitely want to be spending at least 1% of your monthly turnover. So your turnover as an associate would be what you gross that month, not what you're paid by the clinic, but the amount of money you've taken that month, and work out what 1% is of that. So if you're grossing 50 grand a month, then you want to allow £500 a month to go at least towards marketing, but it could be 3%, and then it'd be 1,500. And then for real growth, if you're in a growth phase because you're a squat practice, or you're a new clinician, or you're an existing clinician, you've been a clinician for 20, 30 years, but you've decided that you want to rebrand yourself and do more of a certain type of treatment, then you have to put the money behind it. So then you need to put your 5 to 10% of your turnover into marketing. So, and so that's your decision to decide whether you're spending 1% or 10%, but you do need to have a marketing budget every single month as a dentist, as a private dentist wanting to do these treatments, whether you're an associate or a business owner. So what do you do with the money? You can use it to hire a PR company, and then you could get your name out there. You won't see any immediate return, but ChatGPT will pick up your articles if they're digital. So that might be an investment for you that suddenly has become a more valuable investment than it was previously, because of AI software picking up these articles and giving them quite heavy weight. You will have a social media presence. As dentists, we just don't have time to post on social media. We may have ideas and we may have things that we want to talk about, but they'll stay as ideas because none of us have time. So you really need an assistant for that, whether you're a practice owner and you hire a full-time marketing manager to work in your business with you, and that can be a big move. And I've done that, and it's something that I can talk to you more about. Or if it's just you don't want to do that, but as a practice owner you want to give your nurse that responsibility, or if you're an associate and you want to hire a PA who can help you with your admin and also do some social media for you. There's a lot of young people out there that are really good with social media, even without a professional qualification, just because they've grown up on it. And so you need someone helping with your social media to make sure that it's consistent. The most important thing about posting on social media, and I don't care which platform you're posting on, but ideally I want you posting marketing on all of them, on Instagram and TikTok and LinkedIn and YouTube, and maybe I've missed something out there. And you can use that same bit of content and you can pop it out on all the channels. You can go deeper into it and make individual content for the channels, but if you don't want to, you can make these short videos and get them out everywhere. But I don't think it's the quality of them that matters. I think it's the consistency. It's having an online presence and being out there and letting people know what it is that you want to say, with a goal in mind of the treatments that you want to see and the type of patients that you want to see. So there's social media. Then there's SEO, so you can optimize your website so that you're using keywords so that Google can find you. You can hire companies that can help you help you with SEO. There is, and make sure you've got a personal brand website as well as your clinic website so that people can see what you're about. Your online presence is so important these days. We've talked about PR companies, SEO, we've talked about having a social media presence, and then ads. Let's talk about ads. So there's Facebook and Instagram ads, like Meta ads, but there's also Google ads. The problem can be with Facebook and Instagram ads, unless you're providing a deal or a good price, then you're going to get price shoppers because you're going to them rather than them finding you and coming to you. And so you'll get a lot of leads that will be a waste of time. And so a lot of people just give up on those. But with a clever campaign, they can be beneficial. And then there's Google ads. And, you know, they say that only 6% of people, Google ads can be better because it's someone who's searching for that treatment that you want to do. But only 6% of people actually click on the ads. Most of them ignore the sponsored ads at the top and go to the most organic search result, which is where SEO comes to put you there. So it depends on so again, the money that you put into Google ads may not be as beneficial. But I would say that if you have allocated that marketing spend every month and you know you're going to spend it anyway, then I don't really care where it is that you're spending it. But amongst those people, between getting an assistant or a marketing manager, or spending it on Facebook and Instagram ads, or spending it on Google ads, or spending it on content creation by getting someone to come in and film you for the day, for that month, so that you've created your content for the month. I don't think it matters, but what it does matter is that you're doing something. I hope that helps. We talk about it a lot in my mentorship program. If you'd like to know more about that, then please find the courses mr.co.uk and contact our marketing manager, Laura, who will talk you through what we can help you with. Have a good day.